Okay. Hi, everyone. Welcome to today's webinar, Important Changes You Need to Know About Medicare in 2025. My name is Jenna Mbalo, and I work with the MGFA, and I'll be moderating today's session. Before we get started, I want to just take a minute to thank our sponsors for helping us with these webinars, Alexion, Argenx, Johnson & Johnson. And I'd also want to let everybody know that today's session will be recorded. You're able to view it on YouTube after the presentation. Also, if you'd like to be able to experience captions during this session, you can do so during the live session just by clicking on the little CC button at the bottom of the Zoom screen. We will have a Q&A segment at the end, so we ask that you please submit your questions in the Q&A box located at the bottom of the screen as well, and we'll get to them once the presentation's done. And now it's my pleasure to hand it over to today's presenter, Amy Niles of the PAN Foundation. Welcome, Amy.
Thank you, Jenna, and thank you to MGFA for giving me this opportunity to present to all of you today. Thank you also for joining this afternoon. I know you're likely quite busy during this holiday season, but very grateful again to have this opportunity to talk about a really important subject, and these are the Medicare Part D changes that are coming in just a couple of weeks. Next slide. And just by way of background, I'm Amy Niles. I'm Chief Mission Officer with the PAN Foundation. If you go to the next slide, we'll learn a little bit about the PAN Foundation and what we're going to be covering today. Next slide, please. For those of you not familiar with our foundation, we are a national charitable foundation and healthcare advocacy organization. And we're on a mission to accelerate access to affordable, equitable healthcare. We do that through what we describe as our three pillars: financial assistance, advocacy, and education. Next slide. Some of you may be familiar with the assistance programs that we operate. Today, we operate more than 80 different programs to support people who are underinsured, access the treatments, the medications that they need. And we know out-of-pocket costs can be very, very high, so we're humbled to be able to provide this assistance. In the 2 decades that we have been around, we have helped more than 1.2 million people afford their medications, and that equates to more than $4.5 billion in financial assistance. While really big numbers, we know that there are so many other people out there that need our assistance. Our second pillar is advocacy, where we advocate for policy solutions that will lower out-of-pocket costs and improve access to care for millions of Americans. And finally, education, where we educate patients and healthcare providers about what's often very complicated subjects, including the subject we're going to be talking about today, Medicare reforms. Next slide. And one more. So I'm going to spend a little bit of time talking about these 6 Medicare reforms that were included in the Inflation Reduction Act, which was passed August of 2022. And all of these reforms are law as of today. In 2023, we saw Medicare beneficiaries benefiting from being able to access vaccines without any copays or cost sharing. And for millions of people living with diabetes, having an insulin cap of $35 per month really was a welcome reform. This year, that's ending very soon, we saw an additional 2 reforms. The Federal Extra Help Program, which is also known as the Low Income Subsidy Program, expanded. So now people up to 150% of the federal poverty level, very low income, and those with limited resources or assets fully benefit from this program, which means that most, if not all, of their out-of-pocket costs for prescription medications are now covered. And finally, this year, we saw the 5% coinsurance in what's called the catastrophic phase of the Medicare benefit be eliminated. In essence, this has meant that people on Medicare have experienced somewhere between $3,300 and $3,800 max in their out-of-pocket prescription costs for the year. And now, just 2 weeks away, 2 additional very important reforms will take effect on January 1, a Medicare Part D cap and implementation of the Medicare Prescription Payment Plan. For more than a decade, PAN has advocated for all of these reforms, but especially the ones that are coming in 2025. In fact, PAN pioneered conversation around what we have called smoothing, which is now known as the Medicare Prescription Payment Plan. So let's dive in more. Next slide. We're going to dive deep into these 2 reforms taking effect January 1, the Medicare Part D cap and the Medicare Prescription Payment Plan. So let's start with the Medicare Part D cap. And next slide. So beginning in 2025, there will be a limit on what you spend out of pocket for your medications in the Part D program. This limit or cap is $2,000 in 2025. Now, the cap only includes medications covered under Part D, as in David. It does not include medications under Part B, as in boy. The nice thing about this reform is that it is automatic. Other than having Part D coverage, you don't need to do anything. Completely automatic. Like you do now, you'll continue to pay for your prescriptions at the pharmacy counter, unless you opt into the Medicare Prescription Payment Plan, which we'll review in just one moment. Next slide. The Medicare Part D cap really is going to benefit everyone on Part D in Medicare, especially those individuals who have been used to spending much more than $2,000 for their medications. And data tells us that already in 2024, by the time we hit mid-year, June 30th, nearly 5 million people on Medicare had already reached that $2,000 threshold. So now let's dive into the more complicated reform, the Medicare Prescription Payment Plan. One more. This is a new voluntary payment option for your prescription medications. By law, all Part D plans, both standalone and Medicare Advantage, must offer their enrollees the opportunity to spread their drug costs and payments throughout the calendar year. While the Medicare Part D cap may lower costs for many, the payment plan may make these costs more affordable. Unlike the Part D cap, which is automatic, you need to take action to benefit from this reform. If interested in participating, you need to opt in directly with your Part D plan, either by calling them, their number is on the back of your insurance card, or visiting their website. The Medicare Prescription Payment Plan only applies, again, to those drugs covered under Part D, not under Part B, as in boy. Next slide. Now, the Medicare Prescription Payment Plan is good for patients. This is a very good reform, but it may not be beneficial for everyone. It is especially beneficial if you have a hard time paying for your medications all at once, or if you simply want to budget and spread those costs out throughout the year. If you've spent $2,000 or more already in the first 9 months of this year, the payment plan may be a good option for you. Similarly, if you have had one prescription fill of $600 or more, this could be a good option. If you are not eligible for the federal extra help program, which we just talked about, the low-income subsidy program, the payment plan may be beneficial. And generally speaking, If you cannot get assistance from a charitable foundation like PAN, you might want to consider opting into the program. Now, the best time to opt into the Medicare Prescription Payment Plan is now. We're at the very beginning of the calendar year, but the reality is you can opt into the program at any point during the year. However, the later in the year that one opts into the program, the fewer months you'll have to spread your costs. Next slide. CMS, or the Centers for Medicare and Medicaid Services, has developed a standard formula that all Part D plans will use to identify what your month-to-month costs will look like when you opt into the Medicare Prescription Payment Plan. Your Part D plan will be sending you a bill each month for what you owe for your prescription medications. That bill will include the date by which payment must be made. You will be paying your Part D plan directly. If you opt into the payment plan, you no longer will pay for your prescriptions at the pharmacy counter. We'll go through some examples in a moment, but the bill from your Part D plan will be based generally on what you would have paid for your prescriptions, plus the previous month's balance divided by the number of months left in the year. And it can get a little complicated. Payments may change from one month to the next, and it can be hard sometimes to predict future payments. As your needs change and new medications may be needed, their costs will be woven into the formula. What you should know, however, is that by the time you reach the end of the year, you will not have spent more than $2,000 because of that Medicare Part D cap. Next slide. So we'll walk through three very different scenarios, in part to demonstrate the complexity of this reform. I think when we were all advocating for this reform, we were really hoping it would be much more simple than it is. But we're also going to show that it really will be up to the individual to decide whether the payment plan is right for them. Next slide. So in the three examples that we'll talk about, that middle column is what the patient would pay without opting into the Medicare Prescription Payment Plan. And the third column off to your right is what payments would look like with the plan. So our first example is Joan. Joan spends $500 per month for her medications at the start of the year, and she opts into the payment plan in January. Now, according to the formula Part D plans will use, the first step is figuring out what we call the maximum possible payment for January. To do this, we're going to take that $2,000 cap, subtract 0 from it because Joan does not owe any prior out-of-pocket costs, and we'll divide 2,000 by 12 months remaining in the year to get that $166. Now, since $166 is less than the $500 she would have paid in January, the Part D plan will only bill her for that $166 in January. Now, her remaining balance in February is the $500 from January, less $166, which is about $333. And we're going to add $500 from February onto that balance to get about $833. Divide that by 11 months remaining in the year to get around $75 as her payment in February. Now, notice that without the payment plan, she would have reached the cap of $2,000 by the end of April. She wouldn't be paying any more after that. We won't go through all the remaining months and calculations, but you'll see that with the payment plan, her costs vary a bit in the first 3 months of the year and then will be about $181 afterwards. So Joan's going to need to decide what she wants to do. Would she prefer to be done with her payments after April? Or is spreading, like you see here, more affordable? It will be her decision. Next slide. Let's consider George. George spends $80 per month for his medications and also opts into the payment plan in January. Like Joan, his maximum possible payment in January is $166. However, since $80 is less than the maximum possible payment, his Part D plan can only bill him $80 in January. What happens in February? Well, he has zero remaining balance, and now we're going to add the $80 for February, divide that by 11 months remaining in the year. His Part D plan can only bill him $7.27 in February. The formula continues, and you can see what happens to his payments throughout the year with the payment plan. I think that George may decide not to opt in to the Medicare Prescription Payment Plan. Next slide. Let's look at our final scenario. Phyllis pays $4 every month for a prescription. In April, she has to pay for an expensive medication that costs $613, and she also opts into the payment plan in April. She has some large costs for her medications in July and October as well. For Phyllis, the first month's maximum possible payment, which is April, is calculated a little differently. We take the $2,000, we subtract $12 from it, that's that $4 that she spent for the first 3 months, and we get $1,988. We'll divide that by the 9 months remaining in the year to get $220. So for April, since $220 is less than $617, her plan can only bill her $220. Again, we won't go through all the calculations here, but notice the variability between April and December. If Phyllis is concerned about paying $617 in April, she may be interested in opting into the plan. If she's concerned about higher costs later in the year, maybe she'll decide not to. So ultimately, it is up to Phyllis to decide what is best for her based on her budget and comfort level. Next slide. Fortunately, the Medicare Plan Finder has developed a tool that will allow you to review what the Medicare Prescription Payment Plan may look like for you based on your needs. Next slide. Now, I know many of you are likely familiar with Plan Finder. Starting at the Medicare.gov site, you can begin by indicating what kind of plan you're looking for, Medicare Advantage, a Part D plan, a Medigap. And this would have been done during the open enrollment period, which was October 15th through December 7th. You would have been asked whether you currently get help for your drug costs, and as you compare plans, whether you want to see the actual costs. Next slide. You would have entered your known prescription drugs. This is a very important step, your address, and you can select up to 5 pharmacies to compare. Next slide. You would then see the plans to evaluate. And next slide. And you can compare costs by pharmacy. Now, notice on this slide, the highlighted box at the bottom about the Medicare Prescription Payment Plan. If you clicked on that link in that box, find out what your drug costs might look like with this payment option, it would take you, next slide, to a table that based on your needs, your prescriptions that you input, what the Medicare prescription payment schedule, January through December, would look like for you, or at any point in the year based on when you opt into the program. Unfortunately, you can't opt into the Medicare Prescription Payment Plan today through Plan Finder. That may come in the future, but for now, we recommend that you can use this tool on Plan Finder to help you decide if the payment plan is right for you, and then if you decide that it is, you can then go to your Part D plan to opt in. Next slide. Let's talk a little bit about the bills you will receive from your Part D plan. Each bill will indicate what's owed and the date by which payment must be made. If a payment is missed, the plan will send you a reminder. You have up to 60 days to pay the unpaid balance, at which time, if remaining unpaid, the Part D plan will disenroll you from the Medicare Prescription Payment Plan. You will not be disenrolled from the Part D plan itself. You can always opt in again to the payment plan after the unpaid balances are paid. Next slide. Right now, opting into the Medicare Prescription Payment Plan is an annual requirement, even if you stick with your current plan. This may change also in the future. Of course, if you change plans, you need to opt in with the new plan. Next slide. If you opt in and afterwards decide for whatever reason it's not right for you, you can opt out simply by contacting your plan. This will not impact your participation in the Part D plan itself. All unpaid balances will need to be paid, and after opting out, you will return to the pharmacy counter to pay for your prescriptions. Next slide. So lots of information about the Medicare Prescription Payment Plan. You can see how it is somewhat complicated. Let's summarize some of the key takeaways about this payment option. This plan may make your drugs more affordable by spreading out costs, spreading out payments throughout the year, but it's not for everybody. We recommend that you first explore options to lower your costs, perhaps through the federal extra help or low-income subsidy program, or maybe through financial assistance from the PAN Foundation or another charitable foundation. If you opt in, you're now going to receive 2 monthly bills from your plan, one for your premium and one for your prescription costs. If you find that you have difficulty paying both bills at any time, we always recommend that you pay your premium first to protect your prescription drug coverage. This reform comes with changes for the Part D enrollee. The first is that, unlike the Part D cap, you have to take action to benefit from this reform. You have to contact your Part D plan either by calling them or visiting their website to opt in. And secondly, as we've discussed, if you opt in, you won't be paying for your prescription medications at the pharmacy counter. You'll pick them up, but your Part D plan will send you that monthly bill, which you will need to pay. Next slide. So one more. I know I've shared a lot of information about 2 very important reforms. Just wanted to look at them side by side with you to review the differences. So, does the reform lower my prescription costs? Well, the cap of $2,000 puts a limit on what you spend, and depending on what you have historically spent, may very well lower your costs in 2025. The payment plan does not lower your costs, but it may make them more affordable. Who's eligible for each? Anyone with a Part D plan will benefit from the cap. Anyone enrolled in a Part D plan is eligible to opt in to the Medicare Prescription Payment Plan. What actions must I take to benefit? Well, with the cap, nothing. It's automatic. But since the payment plan is voluntary, you need to call or visit your plan's website to opt in. How will I pay for my medications? Well, with the cap, you'll continue to pay at the pharmacy counter, but if you've opted into the Medicare Prescription Payment Plan, you will be billed monthly by your Part D plan. Next slide. And one more. So we are on a mission, along with other patient groups, to educate people on Medicare about these two reforms. And one of the reasons why we are doing this is simply there's very low awareness of the reforms. We actually conducted a poll about 6 months ago of people on Medicare throughout the United States. And we're going to be following up with a very similar poll in just a few weeks. But if you go to the next slide, and this wasn't a terrific surprise to me, but close to 9 out of 10 individuals on Medicare in June were not aware of either of these reforms coming in just 2 weeks. There was a little bit more awareness around the Medicare Part D cap that has certainly been talked about more publicly, but much lower awareness about the payment plan. Next slide. So a few takeaways for us from this national poll was low awareness, but yet most individuals are really interested in learning more about the reforms. That's a good thing. As I said, a little bit greater awareness around the $2,000 Part D cap. I think all of us, PAN Foundation, MGFA, other patient groups, provider groups are really in a position to educate their constituency about these reforms. It's critically important, especially the Medicare Prescription Payment Plan. And when it comes to the payment plan, I think greater education around the benefit of the Extra Help program in particular is needed. Because if someone is eligible for extra help, they don't need the Medicare Prescription Payment Plan. The Extra Help program is a terrific program operated by the Social Security Administration. And there's an estimate that between 3 and 4 million people in this country are actually eligible for that program, but they haven't gone through the application process for whatever reason. So at PAN, we're doing all we can to educate people, not only about these Medicare reforms, but about the Extra Help program. Next slide. And one more. So early in October, at the PAN Foundation, we launched our own campaign about the Medicare reforms. Really, since the Inflation Reduction Act, we have had what we call an education hub at panfoundation.org about the reforms. All of that information has been updated. It is a great first step to learn about these reforms. We created educational booklets, video explainers in English and Spanish. I participated in a national radio media tour to speak with communities from throughout the country, and we've done lots of webinars to educate patients and healthcare providers about the reforms. And since launch in October, our reach has been significant. With the radio tour and with all of our partnerships, we have reached more than 58 million people in this country with information about the reforms. Next slide. So a few resources that are very important to keep handy. One, of course, is Medicare, medicare.gov, or their toll-free number, 1-800-MEDICARE. Secondly, I really encourage you to visit the panfoundation.org education hub, panfoundation.org/reforms to learn more. Many people are not aware of the State Health Insurance Assistance Program. This program offers free, personalized counseling to people on Medicare. And you can start by researching and learning more about that program at shiphelp.org. It is a fantastic resource for people on Medicare. And finally, I have included the Extra Help program so that people can learn more about this really important program to help people with very low income and resources. Next slide. And one more. That really concludes our presentation this afternoon. I do encourage all of you to stay connected with PAN to receive important updates around our assistance programs, all the advocacy work that we're doing, as well as our education programs. But On behalf of PAN, I just want to say thank you again to MGFA, who has been a terrific alliance partner with the PAN Foundation, and to all of you for joining in today and learning more about these historic Medicare reforms coming in just 2 weeks. And with that, I thank you, and I'd be happy to answer any questions you might have.
Thanks so much, Amy. I'll come back on the screen. Thanks so much for a great presentation. That was really incredible to hear that you have been able to reach so many people through your campaigns as well. We do have a couple questions that came in. The first is, for those using organizations that assist with co-pays, would using the payment plan make it difficult to seek reimbursement?
Yeah, it is a great question, and that is a very common question that we have been receiving. I would say in general, if you are seeking assistance for only one disease area or a drug in particular, and you can get the assistance from a charitable foundation like PAN, you should go ahead and do that. And likely you won't need the Medicare Prescription Payment Plan. I think where it gets a little bit more complicated is with individuals who are living with multiple chronic conditions, and that's, of course, very, very common. So it is perfectly fine to apply for assistance from a charitable foundation and also opt into the Medicare Prescription Payment Plan. Because what will happen at the pharmacy counter on the back end is that all those payments will be taken into consideration. And so the Part D plan will only bill you for what may be remaining. But it's a great question.
Great. We have another one. Can you share a bit about the status of telehealth for Medicare participation in 2025, both with regard to medical telehealth visits and for physical therapy telehealth?
Another great question. I'm not 100% sure about the physical therapy, but just learned today that there is a good chance that there will be a 2-year extension on telehealth, ending at the end of 2026. I'm hesitant to say that that is definitive because the year-end package has not been fully negotiated yet, but that is what I'm hearing literally as of this afternoon. That is good news for people on Medicare. At the PAN Foundation and other groups, we were really hoping to see permanent extension of those flexibilities, but we'll take 2 years. It's better than nothing.
Yeah. Does the medication have to be in the plan formulary to apply towards the $2,000 max?
Yes, the drug must be included in the plan's formulary, and that's why we were stressing the importance of the open enrollment period because in 2025, there are many, many plans that are around in 2024 that will just not be around in 2025. And we know that plans are looking at their formularies. And so it is so important that, when selecting a plan, it's not all based on cost and based on premium, but the individual really makes sure that the medications they need are included in formulary.
Thank you. And one more question or just piece of advice that I'd like to ask is, you've been able to provide us with such great information and to really break down what these new changes are and what they mean. What are some resources? I know you shared a lot of different links. What are some resources or ways that community members can actively be on the lookout for these types of updates or changes?
That's a great question. And, I'm always biased toward the PAN Foundation, but if you visit PAN Foundation, you can sign up for email alerts so that you receive information about new programs that we offer or even opportunities to engage in advocacy. So as we advocate for things like telehealth, permanent expansion, we provide opportunities for people across the country to be able to visit our platform and literally with a click of a button, send a letter to their members of Congress saying, please pass X, Y, and Z bill. It's a great way to get involved. So that's probably the best way to stay, or a good way to stay connected with what's going on, at least, on the Hill. And again, new programs that we may be offering at the PAN Foundation.
That's great. Thank you so much. And we definitely like to partner where we can at the MGFA and to help spread the news and advocacy efforts for the community as well. So we're grateful for that partnership with PAN.
Thank you.
Well, thank you everyone for your time today. I hope that you all have a happy holiday season. Amy, thank you so much for your time. This was a
Thank
wonderful
you.
presentation.
Really appreciate our partnership and wish all of you a very happy and healthy holiday season.
Yeah. All right. Take care.
Take care. Bye-bye.
Bye-bye.